healthcare for close to $6,000 per year per person on average. Over the past 50 years, healthcare costs have grown from an afterthought for many families, with nearly all costs paid for by a healthcare plan, to the topic of dinner table conversation and one of the top worries of American families today. Many of my patients have shared their horror stories about the healthcare system, and I have included many of these stories throughout this book. The current cost of healthcare in America is outrageous. In 2010, the Affordable Care Act, ACA, was passed and signed into law by President Barack Obama. One of the compelling reasons for this new federal law was the disgraceful and unaffordable cost of healthcare. The ACA may have slowed the growth of this monster industry, but only by a little. Managers of Wall Street hedge funds have quickly learned the loopholes that allow them to siphon off our hard-earned dollars for profit and administrative waste, money that should be used for actual hands-on healthcare. Our healthcare delivery system is sometimes referred to as the healthcare industrial complex. It is like a gigantic, business-oriented octopus, reaching out to take large chunks of hard-earned money out of our wallets. While prices skyrocket, our politicians in Washington, D.C. argue about how to fix it, and at the same time provide loopholes to an industry that allows it to legally cheat us. Both Republicans and Democrats welcome industry lobbyists into their offices, as well as huge political contributions from pharmaceutical, hospital, insurance, and physician groups, as described in a Washington Post article. This week, pharmaceutical companies, hospitals, insurance companies, and medical device manufacturers practically ran the table in Congress, winning hundreds of billions of dollars in tax breaks and other gifts through old-fashioned lobbying, re-exerting their political prowess. Lobbying and campaign contributions result in regulations that guarantee these groups billions of dollars in excessive profits and, in the end, make the average American family pay. Who makes the rules? During the 2018 election cycle, Senator Mitch McConnell, Republican from Kentucky, the Senate Majority Leader, received campaign contributions of over $150,000 from pharmaceutical groups, and Senator Sherrod Brown, Democrat from Ohio, received over $250,000 from hospital groups. It adds up when all 535 members of Congress are included. Insurance groups in 2018 alone spent $180 million in combined lobbying and campaign contributions. And hospital organizations have spent nearly $1 billion on lobbying the U.S. Congress over the past 10 years to suck more money from you. With such money spent on Congress to increase the money flow in healthcare, is it any surprise that our healthcare costs are outrageous? The driving forces that result in outrageous healthcare costs in America can only be solved by legislation by the U.S. Congress. Doctors, the majority of whom attended medical school to help humanity, now find themselves stuck in the middle as pawns in a complex health delivery system. Doctors and mid-level practitioners order drugs, laboratory tests, X-ray imaging, MRIs, surgery, hospitalization, and so on. These things all make money for pharmaceutical companies, hospitals, other physicians, supply companies, limited liability corporations, and large interstate conglomerates. Without the doctor's order, there's little or no money for these profit-making entities. But even now, few medical schools and teaching hospitals spend much time teaching students about healthcare costs and the power and control that they will have as individual physicians. Shall we return to the horse and buggy days of healthcare? Absolutely not. Medical care has made tremendous advances over the past 30 years. Better medications, incredible cancer cures, and new space-age surgical techniques. But these advances should not quadruple healthcare costs. Much of the increased costs to Americans is caused by Wall Street business models and mindsets that seek to maximize profits. I have personally observed that the European systems of healthcare are just as advanced as our healthcare and provide it at 50% of the amount we spend. So what happened? Why does healthcare cost far more now than when I began my career? Why do families worry about bankruptcy and homelessness because of unaffordable hospital bills? Why do we now spend more than 4 times the 1971 amount, $2,500 adjusted for inflation, for healthcare?